New tonight, this one is happening more than you might think. Confidential medical information being sold to the highest bidder. It's raising questions about whether enough is being done to keep your information from being stolen and exposed. CBS 2's Dana Tyler explains.
It's happening more and more. Your most private medical information sold to the highest bidder, raising questions about whether enough is being done to keep your information from being stolen and exposed.
And I said, leave me alone. I hung up.
Chris Carlin recently got a series of calls claiming she was entitled to a payout if she joined a class action lawsuit involving Zofran, a drug she'd used. Carlin says she was shocked that the callers also knew she had a miscarriage.
This is stuff that they have no business knowing.
She says they wanted her bank account number to add her to the suit, but she didn't fall for that. Carlin became suspicious because in 2012, her hospital notified her that her medical records had been stolen.
That I find extremely frightening.
And she's not alone. Since the U.S. government started keeping track in 2009, more than 30 million Americans have had medical records stolen.
Then you should be considerably worried.
Security expert Paul Violas says it's no wonder. He says thieves get top dollar when they sell the stolen medical information.
The product is actually worth 5 times the street value of any other piece of identifying information. So if your social security number is worth $1, this is worth 5.
And he says hospitals simply don't do enough to protect patients.
They're creating an easy pathway, or a breezeway, if you will, for hackers.
The U.S. Department of Health and Human Services keeps track of breaches. More than 1,000 are on its website. Dozens of hospitals in our area are on the list.
I think it should be a concern for everyone, really.
CBS 2 asked a dozen local hospitals that had breaches to do on-camera interviews, but none would. A spokesman for the Greater New York Hospital Association said hospitals do an outstanding job of protecting patient information. But Viola says hospitals should do more, and patients should demand answers.
Ask them specifically, how are you protecting my information?
To see if your hospital or medical office has had a breach, you can check the U.S. Department of Health and Human Services list of breaches on our website, cbsnewyork.com. Maurice, back to you.